Hi there, I'm Dr. Shika Chabra, one of the GPs at Verve Family Doctors. This is a quick message to let you know some important information about our Pfizer and Moderna COVID-19 booster vaccine clinic. In Australia, we have approved booster vaccines to be given at the moment from 4 months after your second dose, and this will be brought forward to 3 months after your second dose from the 31st of January. Our clinics are run very efficiently because we're trying to vaccinate as many people as we can as soon as possible. So if you have any questions about the booster vaccine or are not really sure whether you want to proceed, please don't book in directly for the clinic, but instead book in a consult with your GP to discuss. There are certain heart conditions that may warrant medical review before vaccination with mRNA vaccines like Pfizer and Moderna. These are quite rare, but they include things like myocarditis or pericarditis in the past 3 months, acute rheumatic fever, acute rheumatic heart disease, or acute decompensated heart failure. If any of those are something you think you may have, again, please make sure you've spoken to your GP first. And the only other contraindication is previous anaphylaxis to an mRNA vaccine, Pfizer or Moderna, or a confirmed component of the vaccine that you've had previously. You will receive an email link for a consent form, so if you haven't already completed that online, please make sure you do complete it before your appointment. And it has been updated since you had your first 2 doses, so you do need to complete it again even if you've had the same brand of vaccine before. If you've had a COVID-19 infection, so actually tested positive for COVID since your last dose, you can still safely receive the booster vaccine, and you can do that as soon as you are out of isolation and all your symptoms have resolved. When you come into the clinic, you have quite a specific time allocated, so please make sure you arrive 5 minutes early, but wait outside the clinic until your appointment time. Please make sure you remember to wear short sleeves so you have easy access and have your left arm ready to go when you arrive. If you would like the vaccine to be in your right arm for any reason, please let us know when you come in. The common side effects that you may experience after either Moderna or Pfizer include things like pain at the site of the injection, tiredness, headaches, muscle pains, fevers, chills, and joint pains, and less commonly you may also get things like some redness or swelling at the injection site, and some swelling and pain in the armpit, enlarged lymph nodes, and some nausea and vomiting. These minor side effects should dissipate over 2 or 3 days, and you can safely use paracetamol or ibuprofen to help manage the side effects, and a cold compress at the injection site can also help. We don't routinely recommend that you take paracetamol before the vaccine. The rare side effects of mRNA vaccines like Moderna and Pfizer are severe allergic reactions like anaphylaxis that we previously mentioned, and this is the main reason why you'll be monitored for 15 minutes in the clinic before you leave after the vaccine is administered. And rarely there's also been cases of inflammation of the heart muscle, which is myocarditis, or the lining of the heart, which is pericarditis. The majority of these cases have been mild and resolved pretty quickly, but you should definitely seek medical review if you think you might be having a severe allergic reaction after getting home, experiencing things like difficulty breathing, wheezing, collapse, any of those things, please call 000. Also, if you have any chest pain, pressure, discomfort, an irregular heartbeat, fainting, shortness of breath, or pain when breathing, you should also seek review. If your symptoms are not urgent but you are concerned, you can book in with your GP to organise further investigation. But if you have more serious symptoms, please just call 000 and go to hospital, particularly if you have severe chest pain. Please remember that the COVID vaccine cannot give you any respiratory symptoms, so if you do develop a runny nose, sore throat, anything like that, then please make sure you go and get COVID tested as usual rather than putting it down to a side effect. Thank you for your time, and we look forward to seeing you soon.